Welcome back. A blesser is typically an older and rich man who provides a younger woman with money, gifts, school fees, or lifestyle access. In return, the younger partner provides companionship, which often includes a sexual relationship. Now, similar arrangements exist around the world, often called sugar daddy relationships, but the South African version is strongly associated with extreme inequality, youth unemployment, and a culture in which conspicuous consumption carries strong social currency. But what are the harmful consequences of young people engaging in these activities with blessers? To help us unpack this phenomena, we're joined by Gavin George, who's a program leader at UKZN's Health Economics and HIV/AIDS Research Division. Mr. George, good to have you on the program this evening. So your latest study provides the first national picture of blesser relationships, but also the effects on young women. What was the most striking or unexpected about your findings, especially when you analyze this data?
Thanks, Lantler. I guess sort of what stood out the most was just how widespread and layered these relationships are. Even though you could argue that there was a nominal 6% of young women nationally who reported having a blesser, this translates into thousands of adolescent girls and young women across the country. And their risks aren't isolated. We saw much higher rates of HIV infection and early pregnancy, as well as intimate partner violence amongst this group. But I guess what really struck us, particularly when we combine this national analysis with some of our qualitative work, was that we're not just talking about impoverished or unemployed young women. Many of the participants in our interviews were educated, aspirational, employed, yet they still engaged in these relationships with blessers. So these are young women who on paper might be considered empowered, but they're still navigating a context where access to economic security and social mobility depends on this male support.
So the term blesser has become mainstream in South Africa, even aspirational for some. What does that say about a broader social and economic environment, especially for young women who are navigating inequality and unemployment in the country?
Look, I think the reality for many young people, and especially for young women, unemployment, inequality, and limited upward mobility mean that the traditional routes to success, like education and stable employment, feel increasingly out of reach, I would suggest. So when the labor market isn't absorbing young people, they have to find alternative pathways to the social visibility and material success. So I think it's within this context that the idea of having a blesser becomes part of a wider social economy where consumption signals value and belonging. So again, I make the point, it's not just about survival, but it's also about identity, visibility, and ultimately the desire to participate in what seems like the good life, I guess. And social media is certainly amplifying this by turning luxury and fashion and travel into symbols of worth. And for some young women, a relationship with the blesser is the only way to access those worlds, to be seen, to belong, and unfortunately, ultimately, to matter.
Yeah. So you found that relationships with blessers often lead to overlapping risks, HIV, early pregnancy, and also gender-based violence. Can you explain how these risks then reinforce one another?
Yeah, it's what we often term the triple threat. And these operates in a vicious cycle. So a young woman in a relationship with an older partner may find it extremely challenging to negotiate condom use. And that ultimately increases her HIV and pregnancy risk. And once pregnant, if she was still in school, then it increases the chances of her dropping out of school, which then has the knock-on effect of reducing her future earning potential and makes her more economically dependent, ultimately and potentially driving her back into risky relationships. So violence, be it physical, sexual, emotional, often sits in the middle of that cycle, both being a cause but also a consequence.
Also interesting is that many young women describe these relationships as initially empowering, but ultimately disempowering. How do you then interpret that psychological and social shift based on your own research?
Look, I think that in the start, a blesser or a relationship with a blesser can generally feel liberating. As you would expect, it would open doors, access to money, fashion, restaurants, social events, a sense of belonging to this higher social world. But for some young women, particularly coming from those backgrounds of constraints and scarcity, it represents a form of mobility and I guess self-expression. But the reality, the real reality is that this empowerment is conditional. It's tethered against someone else's resources and ultimately someone else's terms. So over time, that initial excitement would often give way to, I guess, a sobering reality. So your autonomy is definitely curtailed. So decisions around sex protection or even ending the relationship often rest with the older partner. And what we found particularly striking was that many young women spoke about what they termed this emotional turning point, that moment that they recognized that the power that they thought they had was in fact just a mere illusion.
Your study also shows that age disparity is a key driver of risk. Let's speak about this. What specific role does power imbalance then play in limiting young women's ability to negotiate safer sexual practices?
Look, power imbalance sits at the center of these relationships. When one partner controls the resources, be it money, transport, school fees, university fees, the other partner's ability to make independent choices diminishes, as you would expect. So in these relationships with blessers, this imbalance often plays out most starkly around sexual decision-making. So what we found is that sort of the economic dependence and age disparity combined to ultimately erode that agency.
So economic dependence also then seems to be at the core of these relationships. How can the public then, or public policy, then realistically address the structural issues? We speak about issues like unemployment and inequality that make young women vulnerable to such transactional partnerships.
Look, there's no easy solution to this. I think we certainly have to go well beyond health education and look at the entire economic and social ecosystem that fuels this vulnerability. Yes, poverty matters, but so does aspiration. I think many young women in our studies weren't entering these relationships just to survive, but to belong, to be seen, and to access a sense of the economy that ultimately eluded them. So this means that policy needs to address both the material need of young people and young women in this case, but also the social aspiration. I think real youth employment programs, targeted scholarships, social protection measures are key to keeping girls in school and to providing them with opportunity. But we need to also be a little bit more innovative as well. Think about interventions that provide alternative pathways to dignity and visibility, mentoring programs, perhaps creative industries and entrepreneurship incubators, I think have proven to be successful in sort of small studies. And I think we need to find ways to expand and to ensure that more women have access to those sort of programs.
Gavin, the research also mentions that blessers themselves often have multiple partners. How can HIV prevention and public health campaigns then better engage men, especially in addressing these risk dynamics?
Yeah, I think that's been a real shortcoming. We cannot keep framing HIV prevention as a woman's issue. I think men, we need to include men, and those men that see themselves as blessers as well need to be part of the solution. And this means that programs that challenge harmful notions of masculinity, encourage responsibility, and promote sort of mutual respect are key. Potentially peer-led initiatives, especially those that make safer sex and respect central elements of as the intervention, I think are vitally important.
There's also a moral stigma often attached to blesser relationships, but your work then frames the issue as a structural rather than moral. How important is it then to shift that narrative in order to design effective interventions?
I think moralizing obscures the real causes here. When we judge young women, we often fail to see the structural traps that they're navigating, poverty, inequality, and the social pressure to appear successful. And I think framing these relationships as a moral failing often reduces what is a very complex economic and social reality and reduce it to individual blame. And we need to understand that the blesser phenomenon is structural rather than moral. And only then can we start asking ourselves the right questions, such as what conditions make these relationships appealing or necessary, and what opportunities are missing. And that shifts open space for compassionate and evidence-based responses and policies that expand young women's choices, I think are going to be important to reducing the harmful effects of these relationships.
And finally, Gavin, looking forward, what interventions or programs have you found most promising in really helping young women make safer, more empowered choices as well?
Look, as I mentioned earlier, there's no easy answer here. But what we need now is interventions that link economic opportunity with social belonging and gender equality. We really need to reshape what empowerment looks like. Programs that connect young women with real skills, mentorship, entrepreneurship, and the creative industries, which to some extent can help achieve that sense of visibility and success that these blesser relationships often promise. But importantly, it's on their own terms rather than on an older male's terms. And I think that's where we need to head towards.
Gavin, thank you so much for your time. Gavin George is the program leader at the Health Economics and HIV and AIDS Research Division at the University of KwaZulu-Natal.